Welcome back to MLT 120. Today in lecture we're going to get a little bit more in-depth information on myelodysplastic syndromes, or MDS. So what is the definition for MDS, or myelodysplastic syndromes? It's a heterogeneous group of clonal hematological malignancies. So what does that mean? It's a group of disorders caused by blood cells that are poorly formed and don't work properly. Sometimes something is wrong with the bone marrow is basically what is going on. You see peripheral blood cytopenias. Cytopenias meaning there's lower than normal blood cells. You have dysplastic blood cells, meaning there's abnormal cells in the tissue, usually meaning cancerous. You have hypercellular marrow, meaning there's too many abnormal cells in the marrow, and it usually progresses to the acute myeloid leukemia, or AML. Usually affects elderly people. The median age is 70, rarely seen in patients under the age of 50. MDS can also be referred to as pre-leukemia or refractory anemia. This is the most common other name. It's also referred to as glioblastic leukemia, glio meaning few or scant. So what is the clinical presentation of MDS, or myelodysplastic syndrome? The patient may present to be asymptomatic but may have cytopenia present in the blood smear. The cytopenia may be from one or more cell lines. Anemia is the most common abnormality, and it's seen in about 90% of cases. Also, thrombocytopenia is seen in about 28 to 50% of patients. Thrombocytopenia meaning low platelets. You can see an increase in infections due to neutropenia. Neutropenia meaning low number of neutrophils, and that is going to happen in about 25 to 40% of patients. So what are some of the hallmark findings of MDS? For the erythroid or dyserythroid poiesis, dys meaning bad or difficult or abnormal erythropoiesis. For the peripheral blood, you may see macrocytosis or ovomacrocytes with normal vitamin B12 and folate levels. You might see anisocytosis or poikilocytosis. You may see dimorphic populations, meaning two different populations. You may see dacrocytes, or the teardrop cells, acanthocytes, or our Burr cells, Pappenheimer bodies, remember our inclusion for Pappenheimers, Hal-Jolly bodies, another inclusion, or our nucleated red blood cells, or basophilic stipulin, that's an inclusion. Now for erythroid or dyserythroid poiesis from the bone marrow, you might have multinuclearity, meaning there's more than one nucleus in your cells. You may have nuclear cytoplasmic asynchrony, meaning the cell's chromatin has the inability to mature normally because the cell's nucleus is more immature than the cytoplasm. And then you may see ringed sideroblasts. This is erythroid precursors with iron-loaded mitochondria. And on the slide, it's going to show up as blue granules around the nucleus. So here is our ringed sideroblast. So the mitochondria has the blue staining with the iron deposits around the nucleus. So in the normal erythroblast, here's the mitochondria without the iron granules. But if it has the iron granules in the ringed sideroblast, it would show up in your erythroids, or your red blood cells in your bone marrow. So patients with MDS are at high risk of iron overload because of the ineffective erythropoiesis. So you should perform iron stains on your bone marrow. In MDS, for the myeloid side or dysgranulopoiesis, in the peripheral blood you may see atypical neutrophils, especially the segmentation. You may see pseudo-Pelver-Hewitt cells. You may see occasional hypersegmentation. You may see hypogranularity and granulocytosis, meaning there's a low number of granulocytes in the blood. And occasionally you may see myeloblast. you may see the inclusion dull bodies, which is that blue-gray inclusion in the cytoplasm of neutrophils that's associated with Meheglin disease. For the bone marrow, for the myeloid side, you may see increased cellularity. You may see myeloblasts, immature granulocytes, asynchronous maturation, and also the inclusion air rods. Remember, the air rods are made up of fused granules. Okay, problems that MDS can cause for thrombopoiesis or production of platelets, or dysmegakaryopoiesis. In the peripheral blood and the bone marrow, you may see large or giant platelets. You may see hypogranular platelets. You might see micro megakaryocytes and megakaryocyte fragments. And you may see dysplasia in megakaryocytes. Dysplasia meaning the presence of abnormal cells within the tissue. Okay, we have a FAB classification for MDS, or Myelodysplastic Syndrome, and there's 5 total subcategories for MDS, and they get more severe as you go along. So 5 is worse than 1 as far as the categories go. So for the first category, we have refractory anemia. It's also referred to as RA. And in this category, you have pancytopenia, which affects all cell lines. All cell lines are reduced, meaning the white blood cells, red blood cells, and platelets are reduced. The blasts are less than 1% in peripheral blood, and then less than 5% in bone marrow. You also see the presence of ring sideroblasts in bone marrow at about less than 15%. Remember, our sideroblasts are erythroid precursors with iron-loaded mitochondria, and they appear with a nucleus surrounded by a ring of iron, and the staining is usually blue for those, or that ring of iron around the nucleus. The next category in the FAB classification for MDS is the RARS, or refractory anemia with ring sideroblasts. You have less than 1% blast in the peripheral blood, less than 5% blast in the bone marrow, and greater than 15% ring sideroblast in the bone marrow. Next category is the REAB, or is refractory anemia with excess blast. You have less than 5% blast in peripheral blood and 5 to 20% blast in the bone marrow. No arrow rods for an inclusion. You have rings sideroblasts are variable, and you may see hypergranular neutrophils or pseudopever in the peripheral blood. The next category is RAEBT, which is the refractory anemia with excess blast in transformation. This one you have greater than 5% blast in peripheral blood. You have 20 to 30% blast in bone marrow. You have the ring sideroblasts in bone marrow that's variable, and you may see blast with arrow rods. The last classification category for the FAB system is actually a controversial classification for MDS, but it's called CMML, or chronic myelomonocytic leukemia. And in this classification, you will see absolute monocytosis. You will have less than 5% blast in the peripheral blood, and you can have 5 to 20% blast in your bone marrow. The WHO classification system for MDS has 8 classes or subtypes. The first is the refractory anemia, or the RA. The second one is the refractory anemia with ring sideroblast, or the RARS. Third is the refractory anemia with multi-lineage dysplasia, or RCMD. Fourth is refractory cytopenia with multi-lineage dysplasia with ring sideroblast, or RCMD-RS. The fifth category is refractory anemia with excess blast 1, REAB1. The sixth category is refractory anemia with excess blast 2, REAB2. The seventh category is Myelodysplastic Syndrome, unclassified, MDSU. And the last and 8th category for MDS is MDS associated with isolated delete 5q, and that's a chromosomal abnormality. Now let's just go over a little bit more information about MDS in general. The average survival is less than 2 years after diagnosis, although some patients may survive up to 8 to 10 years with this disease. You can acquire, or it can be acquired, or therapy related. The disruption of apoptosis, or the process of cell death, is thought to be responsible for MDS, and erythropoiesis is a common finding for these patients. So let's talk about some chromosomal abnormalities that's found with MDS patients. We have what's called a monosomy 7. It's a chromosomal abnormality, and if this is found in a patient, these patients usually have a poor prognosis. The next one is the 5q. If this one is found, patients usually have a good prognosis with a median survival rate of about 8 years for these patients. But the most common abnormalities or chromosomal abnormalities found in patients are related to chromosomal abnormalities dealing with chromosome 7 or 5, 7, 8, and 20. This concludes our lecture on MDS or Myelodysplastic Syndrome. If you have any questions, do not hesitate to reach out, and I will see you guys in lab.